I am less than 24 hours out from my skinny BBL with Dr. Steve Torres from Skin and Skinnier here in San Diego. I did an awake procedure, meaning I never went under general anesthesia. I was totally awake and conscious the entire time. And I know when I was looking for providers for my BBL, I had a really tough time finding reviews for awake BBLs and also for my doctor, Dr. Torres at Skin and Skinnier. So I thought I would give back since there were, the girls that did have videos and stuff that really helped me. So I'm gonna share a little bit about that, and I'll start in chronological order because I think that's easier. So I actually initially, when I was looking for lipo, I had 5 years ago, I was really heavy. I was like almost 190 pounds, and I lost most of it through healthy eating and exercise. And then I went to Elite Body Sculpture. I think it's Dr. Aaron Rollins, who's the guy over there in Beverly Hills, but they do that air liposuction that's really popular, or at least it was at the time. So I went there and I just had my abdomen and my flanks done. And I had a good experience, super easy. That was awake as well. And I've maintained a weight. Usually I'm 5'4", and usually I am at about 128 to 130 pounds. That's not like my vacation body, but the weight that I sit at and I'm comfortable at. But even then I found, and I'll post pictures on the Instagram page that I'll have in the description, even when my body was like so on fleek and like so sick, from the back, I'm SpongeBob SquarePants. Like, I feel embarrassed about my butt. Like, I can't even show it. It doesn't matter. I've had personal trainers. I have like done so much, like the healthy eating, like I know all about it. I've been there, done that. I've tried everything keto to like all of those diets, and it doesn't matter. Like genetically, even when my butt is like fit and I do a million squats, from the back, I just still really had that square ass fucking body. And my boyfriend and I went to Greece last year, and I worked so hard on my body for like 6 months, and I looked great, but from the back, SpongeBob SquarePants, and that really sucked. So I also have like really thick arms all the time. That's just like, I got it from my mama. That's her body too. So when I started looking into this, like after the Greece trip, I was just like, I'm done. Like, if I'm working so hard on my body, like I don't want to have to wear, elbow sleeve shirts because I'm embarrassed about how thick my arms are, and like they have like bad cellulite and shit. Like, I don't want to have to like wear sarongs to cover my ass when I've been working on that ass for like a year, 6 months, whatever it is. Like, I was just over it. So I started looking into arm lipo, and then really I was thinking about just getting lipo like on my flanks again, but then I found like BBLs, and it was actually Dr. Torres from Skin and Skinnier who popped up on my Instagram feed, and I saw the results, and I was so shocked because I always thought BBLs were like, those girls you see that are like ridiculously hourglass shaped, like the big hips, like the huge ass. Like, it usually looks like, and I've actually learned like a lot of times it is butt implants, but they just look like, when you see them walking like on Instagram, it looks good, but when you meet those girls in person, like when I've been to Miami, like on the yacht scene, like they look like bumblebees. Like, it is not cute. I don't like it. Like, it might be cute for some people, and like no shade, but like not for me. So I've never looked into BBLs. And then when I saw Dr. Torres' results, I was shook because it was just something totally different. It was natural. Like, these girls looked amazing. It was like their body, but a better version of it. So that's when I started considering it, and I did a ton of research. I went to several consults, not just Dr. Torres, of course. I did notice that a lot of the really well known, obviously Dr. Miami is really famous for BBLs. a lot of the other doctors that are really popular out there. Some of the pricing is really good for some of those. The results are really good for some of those. Dr. Chung, I think he calls himself Chung Money on Instagram, has incredible results. I went through a consult with him and his quote was 20 grand just for the BBL. Like just for like the 360 lipo, like I don't even think I had my arms on that. And it was 20 grand, and he also wasn't even open until December of this year. It's July right now. Actually, when I got my consult, it was like May. So for me, I just like, even though his results were so amazing, I wasn't gonna wait till December. Like I want a good body now, and I just didn't want to wait. Like that was just my personal choice. He is probably the only other provider though that I would have considered. I went to a lot of the providers. Most of them do the BBLs under general anesthesia, and because I had done the awake lipo before, I knew it wasn't really that big of a deal. But there were so many horror stories out there on the BBL experience awake, so I will get into that later. But for me, it made sense for me. It was really important to me. Number one, general anesthesia, it's hard on your body. When I'm watching the recovery of the girls that were coming out of BBL under general anesthesia, dang, like it was bad. They are like incapacitated, you know, they're having trouble walking, like they're peeing on themselves, like they can't even go to the bathroom by themselves, like they're down and down for a while. I even watched, like Dr. Miami has videos out there for day-by-day post-op instructions for his BBL patients. And I just watched that because I wanted to see if like he reinforced that, you know, the recovery from a general anesthesia BBL is rough, and that is the impression that I definitely got. And in talking to many of the doctors, you know, telling me that I needed to be out of work for a week or longer, that I wouldn't be able to like care for like my boyfriend's 7-year-old or my dogs or anything like that. You can see here, like I have my dog with me. We've been good, and I will go through like how great the experience has been. But the other thing too, like general anesthesia in general, like you just, in my experience, like I try to keep my body really clean. And I just think that the less times that you have to go under general anesthesia in your life, probably the better. So I will save my general anesthesia for things that are really medically necessary, you know, maybe when I'm older. But it just wasn't something that I wanted to do. It just freaks me out. Don't like it. So I then knew I wanted to do the awake BBL. There aren't really a ton of providers that do it. When I talked to other plastic surgeons about Dr. Torres and the awake BBL, they really discouraged me from it because they said that he would not be able to get as much fat from me, and that he would not be able to have like as dramatic or as good results because of the fact that I would be awake, and it could possibly cause too much pain. One of my huge concerns with the BBL surgery in general is that it has a really high fatality rate. And I think it may be the highest or one of the highest fatality rates for all plastic surgery procedures. And the reason for that is the risk of an embolism. Some plastic surgeons, for the most part, from what I understand, it's caused from having the fat injected into muscle in a way that somehow is damaging or just causes the incidental risk of an embolism or clot forming and traveling to your lungs, your heart, your brain, somewhere bad, and you die. So that being said, most plastic surgeons, I think within at least the last 5 years or so, have stopped injecting you know, into the muscle or under the muscle, wherever it is that they were doing it. That's not true of all surgeons though, because I did speak to two plastic surgeons who did it under general anesthesia and did still feel that it was safe as long as precautions were taken to inject it that way. So immediate no for me. Like, I'm not trying to die over a butt. Like, that's embarrassing. Like, if I go out, it needs to be for a decent reason, and throwing my life away for that just seemed really dumb. So one of the perks, the positives of the Awake BBL is that my body is still responding. You know, my muscles are twitching. I'm not paralyzed, so to speak. I can feel things and talk to Dr. Torres during the procedure. So if at any point he were to even accidentally or incidentally go somewhere maybe he shouldn't be, it would be something that he would be able to feel and see, and I would be able to vocalize. And the idea of being able to be my own advocate and even having the illusion of some sort of control over that happening was a huge bonus for me. And like, for me, that's just like a slam dunk. Like, if you can participate in your procedure and communicate how you're feeling, if something's feeling wrong or bad to your body, especially when it's something that like your life is literally in danger, there could be a fatality there could be complications, why would you not go with that option? So for me, Awake BBL was just hands down the best way to go. I did talk to Dr. Torres specifically about it, and he did not agree with the fact that he would not be able to get the dramatic results. Looking at his results, I did see a dramatic difference. I don't see the bumblebee look on most of Dr. Torres' patients, but I don't think that that has to do with any limitation of Awake BBL, but rather what maybe his preference is and his patient's preference and what they're looking for. So I went definitely with the Awake BBL. Dr. Torres specifically, he is not a board certified plastic surgeon, and that's another thing that I heard from the other surgeons that I consulted with over and over again. He is board certified as an emergency physician, and he was an emergency physician for I think it was maybe 16 years, more than 15 years. He decided to get out of the emergency scene and start working aesthetic medicine. I think it was about 5 years ago, and he has been doing that ever since. So I'm big on the Real Self website. I've been really engaged with that community, and Dr. Torres was very low on my list initially because of the fact that he wasn't board certified in plastic surgery, and we always hear how important that is. And because Real Self actually would not allow him to be on the website for reviews and photos and all of that stuff because he wasn't board certified. I don't really understand why that is, because they do allow international providers that are subject to different, certifications and things like that, where maybe it wouldn't even be the equivalent of a US board certification. So I don't agree with their policy, but that is what it is. And for that reason, it really put me off that I couldn't go through and get, real patient feedback from Dr. Torres' patients. And so that's one of the reasons that I'm doing the video, because I think it's important to give that back and offer that, since I know a lot of us use Real Self and haven't been able to find that. So he isn't board certified in plastic surgery. For me personally, if I was going for a full tummy tuck with a breast augmentation revision and, I don't know, a rhinoplasty or something, like that might be something that was a concern to me. But he's doing liposuction and BBLs, and it's under Awake, anesthesia, local anesthesia, I guess you would say. So, I just don't think it's that big of a deal. It just doesn't bother me. I don't know. Honestly, the fact that he was an emergency physician is so reassuring to me, because that's what he trained for, during his residency, and that's what he did for 16 years. And someone that's an emergency physician is somebody that knows it all, because anything can walk into that emergency room at any time, and you have to be equipped to handle it, to know where to send it, to know, how to gauge how serious it is, to triage all of that. So for me to have somebody where if something did go horribly wrong during my procedure, would probably be way better, well equipped to handle that, more so than, in my opinion, a regular plastic surgeon. Dude, slam dunk. Who better would you want to be taking care of you in that situation than someone who has worked in an emergency room for 16 years? like, of course. So for Dr. Torres specifically, you know, I understand the concern over the plastic surgery certification. I get why that makes sense. For him specifically, I just felt like it was supplemented by other facts and was fine for me. I'm thinking of like Dr. Hagstrom, for example. There were so many surgeons that were like, you're gonna die. You know, if you go to Dr. Torres, you're gonna die because he's not board certified, and you know he can't operate in a hospital. He doesn't have admission privileges, and I'm like, okay, if something goes so badly that I have to get admitted to the hospital, I don't want a plastic surgeon working on me anyway at that point. So what does it even matter? Like, I'm sure Dr. Torres can get me in an ambulance and get me to the hospital like any other doctor, any other board certified plastic surgeon. So I just didn't think it was that serious. So anyways, the last thing I'll go through, oh wait, one other reason. This is getting long-winded. Is it normal for these videos to be this long? Fuck. Just fast forward it or something. I'm sorry. One of the other things I noticed when I was shopping for surgeons, a lot of the Beverly Hills physicians, and I don't mind, like, I definitely believe that you get what you pay for. So, you know, with hair and plastic surgery and fillers and all of that, don't go for the discounts. Put your money, like, you want to pay for the best of the best. And, you know, sometimes that's not always necessarily, like, the cost doesn't always justify, but a lot of times it does correlate. But one of the things that I noticed about the plastic surgeons in Beverly Hills and here in Southern California in general is they have like this thing now with social media and everything with like VIP patients, and they'll like post like their Instagram model coming in who has like 500,000 followers, and it's like, this is our VIP patient and she's getting the best of the best, and you know, here we are getting right in, and here she is sharing her story and all of these things. And I think that definitely makes sense from a marketing perspective for that plastic surgeon, you know, that he's working on these beautiful bodies that have a lot of attention and clout and are gonna probably bring in other patients. For me personally, it really put me off, because what you're telling me at that point is that since I only have 1,000 followers on Instagram and it's like private and all people that I actually know, I'm not VIP. I'm not important. I went to a plastic surgeon, one of these VIP guys who's really big on social media, you know, Snapchat and the whole thing. And I had to wait an hour for my consultation appointment. And I don't like to wait. I don't like to wait. I really did not like to wait. I stuck it out because I really thought that he was really good and that it would be worth it. And also with COVID and just surgery in general, you know, you never know when you could run over. You have to be a little understanding, I think. But there was a little part of me that was like, is this because I'm not VIP? Like, and the Instagram model just came in and like had her appointment because there were like other beautiful women there for their appointments. So to me, I mean, all of our money is the same. Like, my $10,000 is exactly the same as her $10,000. So I deserve to be treated, unless you're gonna give me a discount for like being a peasant and like having to wait all the time for my appointments. Like, I didn't like that. You know, there was like a lot of snobbiness and snootiness from girls in like a lot of the offices. And you know, the thing is, I think all women, you know, we have our insecurities, but also like if you're going to a plastic surgeon, you're obviously like, you know, really insecure about something, and you never know. You know, for me, I'm a little bit more comfortable, but like, you never know who's like really struggling and like who's going in there for something that's been like a lifelong like pain point for them, and now they have to like disrobe in front of a complete stranger, multiple strangers, you know, maybe these snotty girls that are at the front desk, the nurses. And you know, I just think of those women and how hard that could possibly be for them. And so the snootiness and the snobbiness, like, I just don't like that. I don't like the VIP thing, because you're just telling everybody else that we're not as important, and I think that every patient should be important. So that experience I had for a majority of the plastic surgeons here in Southern California in Beverly Hills, and I am telling you, I went to the best of the best, because like I said, money is not really like the top decider for me. I wanted to go to the best one. So that wasn't even the issue. It was like a lot of the snobbiness, a lot of the VIP thing that really put me off. Walking into Dr. Torres' Skin and Skinnier, like totally different experience. Everyone is so down to earth. April, I think, is the name of the nurse there, who honestly, an angel. Like, she is so gorgeous, she's so beautiful, and she's so down to earth, and she's welcoming. All of them were, like Tiffany, who was the nurse, who was the, I guess maybe the operating assistant. I'm not quite sure what you would, what the title would be, but who was assisting Dr. Torres during the surgery. Doris, who is Dr. Torres's wife, was in there as well, and she came in during my surgery and checked on me, and it was like, it was so nice having her in there because she just had such a good energy. And like, when you're like exhausted or going through something, like on that table, all of that good energy, I am telling you, it makes such a difference and in the whole experience. And that's the experience I had with them from start to finish. Like, every time I called, all of my long emails with all my questions, like, they never made me feel stupid for it. And I had some, like, I was obnoxious, you guys. Like, I'm annoying. I was an annoying patient, and they were so great with me, and just never made me feel like I wasn't a VIP every time I walked in there. Like, I was surprised, honestly, after all of my consults and everything, when I walked in and April recognized me. What? Like, you know who I am? Like, I am a VIP. Like, it was so different from my experience, you know, where you'd walk in and the girls did not even know who you were and they didn't care to. So, you know, the fact that they put that attention and that focus on their patients was just beyond for me. The last thing was the price. So this is publicly posted on his website, so I think I'm okay to go ahead and share this. I do, disclaimer, need to share that it does vary depending on your body and your case, maybe how complicated it is. So you would need to do a consult with Dr. Torres to confirm. But I think the general rule of it is, and you can just go to his website. All of this is there. If you go to this section, it's Skinnier. You can get a free, the consultation is free, by the way, and you can just send him photos. That's what I did. So I didn't even drive down to San Diego. I just sent him my photos and talked to the girls at the front desk to get everything. Okay, so liposuction part 1. I don't know if that's in focus. Just trust me, it's there. So the first area of liposuction is going to cost you $3,500 as a base level price estimate, okay? Again, you have to get a consultation. $3,500, so that could be like your stomach or abdomen. The thing that is different from Dr. Torres than other surgeons is that when he says stomach, abdomen, he's talking about your whole thing. So under your boobs and like all the way up here, like he does it all. And I haven't actually seen my results yet, but when I was feeling him, I think he actually went pretty low too, which is really nice because I actually have a really... like, Nicki Minaj talks about a fat pussy in like a cute way, but like this isn't cute. Like this is like, I just like have like a really like a bulge. I think it's from when I did lipo way back when in 2014 or whenever it was. Yeah, but I felt him like down there, so I'm hoping maybe he got some of that off. So that's $3,500. And then every next area after that for the liposuction is going to be about $1,500. So that is usually like your flanks, which is like down here. I think you would call that your muffin top too. Don't quote me on that, but I think that's that area. Like your back area, the back fat area. And then your bra roll, which is up here. And then, and actually I think the flank actually might cover like from, I don't know if you can really see, like I think the flank might be like this whole part. You definitely want to do your flank area. Like, why do your stomach, abdomen if your back's still like sloppy? So you got to do that. Your bra roll is up here, so of course those little rolls that hang over our bras, you know about that. Inner thighs and your arms. And when he does the arm, he does only do this lower arm part. I was a little disappointed about that because I really wanted to do my whole arm because like I said, I'm really insecure about my arms, but I've read so many reviews that doctors don't do it because it's really hard to get a good result. And I saw a lot of horror stories with whole arm lipo, so I was okay with that. But anyways, all of those extra areas would be $1,500 per area. So again, flanks, bra roll, arms, inner thighs, those would be considered additional areas. Now again though, you don't have to do your stomach or abdomen as the first part. Just know that whatever it is that you do, it's $3,500 just to start lipo, and then $1,500 for each area after that. And then, let me fix my little BBL pillow. Your actual BBL to get the fat injected is, I think it's $3,500 too. I should have been prepared for this. I think it's $3,500. I'm like pretty sure. It's $3,500 for the fat injection. Yeah, probably. So that would be the fat for the butt, like the actual BBL part. He also, I did see on his website that he has the option to also do the fat deposit to the breasts. I did not, I'm actually glad I didn't explore it because I didn't end up having enough fat for it anyway. But that's something that doctors are doing more and more these days, and I didn't look into, but apparently he is able to do. So just know that. And then that price includes your pre-op appointment and your post-op appointment for him to remove your sutures. It doesn't include any of your compression garments. So you're gonna have to get your faja that I'm wearing right now. If you do arm lipo, there's also an arm sleeve that goes with that. And then you're gonna need foams, an ab board, there's like a little belly button thing to help keep your belly button right. I also bought, I'm gonna do a board like on my back and on my front when I'm able to do that. So I would say I spent probably $400 or $500 on post-op stuff, but I also bought a lot of extra stuff. And I bought some extra fajas because I wasn't sure what was gonna be comfortable. And at some point you're supposed to stage down into a tighter faja, so you have to get two anyway. I think at their office the fajas were like maybe $100 a piece. So be prepared for that. And then the foams and the ab board I think were like $30 a piece. So yeah. Oh, and also the fat transfer to the buttocks is $2,500. It's not $3,500. So yeah, so for most people it runs around $9,000. I added $1,500 for the arms. So yeah, I paid $10,500. And then it also, you have to pay a $1,000 deposit to secure your surgery date. And then of course that comes off the price when you pay the final price. And that final cost is due at your pre-op appointment. So I think that covers everything. I'm going to go ahead and stop this video and go through with my actual procedure details. So thanks for watching. Feel free to message me if you have any questions or comment. I'm also gonna post my Instagram page here with like a lot of before photos and things like that, so you can see actual photos and footage. Okay.